Now we have our next speaker on psychiatric comorbidity in patients with disease.
Yes. I'm an otolaryngologist and psychiatrist in Miyazaki Prefecture. Since I will talk about psychiatric comorbidity in patients with dizziness. Since 18 years ago, in our psychiatric hospital's clinical consultation room, we started following up patients with otolaryngologic, psychiatric, and neurologic diseases. Patients with dizziness are sometimes suffering from mental disorders too. Conversely, psychiatric patients are often complaining vertigo. She was a young schizophrenic patient and had been suffering from vertigo. She had right breathing disturbance. We classified 3 types of psychological dizziness: narrow type, wide type, psychiatric comorbidity. Narrow type is limited only dizziness of unknown cause. And this unknown cause is a little bit typical in the American cause. Not specific origin, it's unknown cause. But patients with many diseases often have anxiety or depressive disorder. Then in these days, wild type is common. In both types, otolaryngologic disorder is related to psychiatric disorder. However, it is very difficult to clarify the relationship between otolaryngologic disorder and psychiatric disorder completely. Therefore, psychological dizziness in this study indicates psychiatric comorbidity. Wild type includes narrow type, and psychiatric comorbidity includes wild type. The subjects were 524 patients with dizziness. Patient group consists of 159 male and 365 female. Mean age was 59. Patients were diagnosed as otolaryngologic disorder and psychiatric disorder using ICD-10. Patients were diagnosed as dizziness of unknown cause in about 50%, autogenic vertigo in 80%, mania disease in 15%, chronic cerebral insufficiency in 10%, BPPV in 5%. This is the result. Psychiatric comorbidity was found in 362, about 70% out of 524 patients. Narrow type was revealed in 94, 18%. This number is much more prevalent rather than only 5 cases, 0.003% out of 1,493 patients in the Department of Otolaryngology in Miyazaki University. I believe that I could not find mild or moderate psychiatric disorder when I was an otolaryngologist. Typical psychiatric disorder in patients with dizziness was thought to be anxiety, panic, mood, somatoform disorder for otolaryngologists. In this study, various types of psychiatric disorder were found, such as anxiety or panic disorders in 57%, mood disorder in 13%, adjustment disorder PTSD in 7%, dissociative disorder in 1.4%, somatoform disorder in 1.4%, and neurotic disorder in 5%. Furthermore, we found 7% organic mental disorder and 5% schizophrenia patients. This is very important slide, but the number is a little bit changed for abstracts. These 3 diseases in the patient with these 3 diseases shows higher prevalence of psychiatric comorbidity. And the chronic cerebral insufficiency is not so high, but it's moderate. important correlation might be found between dizziness and psychiatric comorbidity about these papers. Acute psychiatric disorder was detected in 68% patients with dizziness. Patients with vestibular migraine and menial disease showed higher prevalence of psychiatric comorbidity. In this study, we get similar results. These patients were not only treated by otolaryngologists, but also received psychiatric comorbidity, or 73% of patients were prescribed psychotropic drugs. Otolaryngologists consider that patients with severe psychotic disorder should be consulted to psychiatrists. However, psychiatrists examine the patient with no psychiatric disorder and with dizziness, common cold, severe tinnitus, and hypertension. Then it's okay to consult to psychiatrists whenever otolaryngologists want to consult, even if psychiatric disorder were mild. Collaboration between psychiatrists and otolaryngologists is very important, not only for otolaryngologists and psychiatrists, but also for the patient with dizziness. This slide Dr. Nakayama gave me. I like this slide. And in 2 weeks later, at Keio University, there is a very, very exciting discussion meeting and the very exciting psychosomatic medicine in otolaryngology. Dr. Ogawa, Dr. Murofushi, Dr. Kanzaki, a lot of doctors. And Dr. Sakamoto's presentation is very, very exciting. It's like a movie or entertainment TV show. Conclusion. Here, we reported psychiatric comorbidity in patients with dizziness in psychiatric hospital. Psychiatric comorbidity was revealed in about 70%. Various types of psychiatric disorder were found. The therapies were not only otolaryngologic, but also psychiatric, and were needed to apply the psychotropic drugs. We believe that collaboration between psychiatrists and otolaryngologists in the hospital or doctors in local area can improve the mental condition and quality of life of patients suffering from dizziness with psychiatric comorbidity. Thank you for listening.
Thank you for your nice presentation. I think we all believe in the message of collaboration that you've given us. Any questions from the floor? Yes, please.
Thank you for the presentation. One question. Actually, patients with psychiatric disorders are taking many medicine for psychiatric disorders. How do you exclude the possibility of drug-induced dizziness?
It's a very difficult question, but this patient, there's no psychiatric medicine, psychotropic drugs for the 30%. 30% patients don't want to take a medicine. Then only psychotropic therapy or only talking. Then I think it's a very big problem. But I think what's the anti-epileptic drug or an anti-epileptic drug is very obvious dizziness. But epilepsy occurs or organic mental disorder occurs dizziness or vertigo and making nystagmus. Then the judging is very difficult to say. I can't say.
Thank you. So we have to limit to save time to only one question. Yeah.
Thank you very much, Dr. Jomi-san. I'm so impressed by the high rate of the psychiatric comorbidity in this patient. But I think that was partly because you saw the patient in psychiatric patient hospital.
Yes.
So what do you think of the general rate of such patients in the general ENT clinic?
General ENT is a very difficult question because I think general otolaryngology is very strict to find a psychiatric disorder because psychiatric disorder, mild psychiatric disorder is very difficult to find. Then I think a little bit, 70%, about 70% rate is, I think, moderate because a German doctor, psychiatrist, said that same rate. Then I heard about other psychiatrist in Kurume University. He said in the physician or otolaryngologist thinks that sleeping disturbance, but that patients go to psychiatrist. The diagnosis is major depression. Then it's a change. Then I think psychiatrists can detect, found mild psychiatric disorder. Okay.
Okay, thank you so very much for your presentation.